sponsored by the Springfield Clinic.
On this Wellness Wednesday, we're joined by Dr. Joel Wietfeldt with Springfield Clinic's Center for Plastic Surgery. Dr. Joel, good morning to you.
Good morning.
Thank you for being here with us. Today is all about breast reconstruction. So first, start out by explaining to us what exactly is breast reconstruction.
Sure. Breast reconstruction we use as a way of creating a new breast or rearranging a breast after maybe a lumpectomy has been performed or a mastectomy, a lot of times in relation to a breast cancer procedure that it's done.
And is that something, the reconstruction, does that happen right away or is it done later on down the line after a diagnosis?
Yeah, a lot of times we try to do it at the same time. There are some benefits of doing it and using the skin that's there and trying to preserve some of that. There are some times where the situation may be a little bit harder on the patient or health risks, and so delayed reconstruction may be done where we start the process on the road after they've healed from their maybe cancer procedure in this instance.
And you mentioned some of the skin being preserved. Is that something that patients can have if they want to use some of their same skin?
Right. Some of the skin we can use to, it kind of has a memory, so it's a nice way to start the process and try to use some of that. Sometimes scarring can happen where the tissue will kind of shrink or tighten in or scar in, and it's a little bit harder to use that, a little less natural looking potentially if not done at the same time.
Talk a little bit about the recovery process. What is that like for patients? I know it's probably different for everyone.
Sure. I mean, a lot of times we're doing surgeries and they're actually an outpatient procedure, even with combination of the breast cancer part and then the reconstructive part. Sometimes we do surgeries that are more like a breast reduction where the cancer is removed and then we're rearranging the tissue and even doing a symmetry procedure to the other side, but it's all soft tissue and not real deep surgery, so it's something that people can tolerate and even go home the same day.
Has the surgery changed in any way with being in this COVID-19 pandemic?
Yeah, sure. I mean, there are sometimes restrictions. Obviously, things change depending on what level we're in and restrictions, but a lot of times we're able to continue on with the reconstructive part because it's part of the cancer procedure and nobody's going to delay getting their cancer procedures done in a reasonable time. So it really hasn't affected things too much from a timing standpoint and being able to get your reconstruction done as well.
Okay, that's some good news. And talk about insurance. Does insurance cover that type of procedure?
Yeah, there are very good laws out there for definitely for reconstruction after a mastectomy, and even covering the contralateral or the opposite breast can be covered as well by insurance. So we're fixing up one breast after cancer, but also then can give more of a symmetry to the other breast at the same time, and insurance tends to cover that. Very rarely are there instances, maybe even a couple of surgeries later, for trying to fine tune some things that insurance may have a little bit of a trouble with that, but overall, most of the surgeries are always covered by insurance.
All right, Dr. Joe, a lot of important information there. Thank you so much for being with us.
Thanks for having me.